Communities, countries, and ultimately nations are only as strong as the health of their women. I've been working as a medical doctor in Malawi for over 3 years now. Malawi has 500 practicing medical doctors for a population of 18 million, and 83% of this 18 million live in the rural areas. I was practicing in the urban area, so I asked myself, have I positioned myself in the right place to provide services to those who need them the most, the 83% who are in the rural areas? Malawi has a lot of challenges when it comes to healthcare. One of them is cervical cancer. Malawi has the highest number of cervical cancer patients. We get 4,000 cases every single year, and we find 60% of these 4,000 cases die within a period of 2 years. Why is that? I wanted to find out, because cervical cancer is completely preventable and also curable. So I did my research. To find the correct answers, I had to go to the rural area. I had to go to the 83%. And I found my answers on the way there, even before I got there. I found that access was a problem. The roads were bad. In some cases, there were no roads at all. There were rivers without bridges. Some bridges had been flooded, they had been swept away. I had to get on motorbikes to get to some of the places. And even when I got there were long queues. There was a lot of work. I had to see 100+ patients every single day. I became frustrated and I became tired. Now this is me. I am young, I'm healthy, but I'm struggling this much just to get there. I'm struggling this much just to function. What more a woman who has many children, many other diseases, how is she going to feel? What is she going through? Let me tell you a story. My name is Cecilia. I'm 32 years old. I've been married for 17 years and I have 5 beautiful children. However, my family is cursed. It's cursed with disease. My husband, 3 children, and I have been on HIV treatment for more than 5 years now. Every 3 months, I have to walk. I have to go to the health facility to get medication for us. The roads are bad, and even then, sometimes the rivers are flooded, but I still have to go. In the past 6 months, I haven't been well. I've been having bleeding, pain, and foul discharge between my legs. I've been to the facility 6 times now, and the medication they're giving me is not working. And I still have to go, because I haven't given my husband his conjugal rights in a long time. If I don't give it to him, he's going to leave me for another woman. Who's going to feed my children? Who's going to take care of me? Every time I go there, there's only one nurse to see all of us. I understand that she's busy, but does she understand where I'm coming from? This is the problem that we're facing in healthcare in Malawi, and I'm sure in many other African countries. And it's not just in healthcare. Education, agriculture, human rights. Even when you have resources which are limited, even when you have skilled personnel who are limited, the problem is access. But that's the beauty of the age that we live in today. We live in the age of technology. We live in the digital age. My name is Zayithwa Fabiano. I'm a research scientist and I work in digital health innovation. I use anything from mobile phones, I use applications, I use drones, and I use satellites to bridge this gap between my patients and the health services that we can provide for them. Nelson Mandela said, "It falls upon a generation to be great, and you are that generation. We are that generation. We are the generation of digitization. We are the generation of technology. I implore all of you, digitize your work and you will revolutionize the world." Thank you.